Dr. Walker, and I've been here since 2003. A lot of times when I go to talk to audiences, I think I can kind of sneak in under the radar because they don't know too much about me. But since I've been here since 2003, I think that's kind of out of the bag. So I'm going to give my disclaimer right up front. Here it is. The information that I'm about to share with you is very, very narrow and very, very focused. The majority of the ladies here probably won't need to heed anything that I say because you guys are doing it already. My message comes as a result of my practice, and as the introduction said, I've been in practice since '91, so 2011, that's 20 years. And the practice of medicine, and you always hear that word because it is so very appropriate. It's like the practice of dance, the practice of music, the practice of being an artist. Over the years, the medical science, the medical information that we learn in medical school, and as a disclaimer, many, if not most, doctors that go to medical school have had their undergrad training as some type of science-based information. I myself was a biochemist, so I spent a lot of time in the lab. So when you come from that laboratory science base, you go through medical training where you have hours and hours of just devouring facts, facts, facts. When you get out into real world private practice, it's like a reality check. Two worlds colliding, two worlds clashing. And so initially when you have that and you get out in practice, you tend to insulate and isolate yourself with the medical facts. What does the textbook say? What does the textbook say? Here's a medical problem, a patient presenting with this complaint. Well, the textbook says X, Y, Z. Let me go to the PDR, which is a big volume book of medications and drugs. Let me look up what medication or drug goes with those particular complaints and that disease process that I know so well. Let me write a prescription, hand it to the patient. Patient's happy because they've got a prescription that they can go to the pharmacy for, spend a couple of bucks, or now a lot of bucks, and of course the doctor's happy because I followed my protocol from the wealth of knowledge that I've been trained in medical school, and I've delivered it to the patient. Sounds like a perfect marriage. No. But here's the glitch. My unique specialty, which is general surgery, and let me back up a little bit. I have to give a little background here. As is the case with all medicine, it started off many years ago with the one-on-one practice of an individual that had some basic knowledge about the human body, delivering that knowledge and care to an individual that was ailing. And as that dynamic between a physician and a patient evolved over the years, our technology, our pharmacology, our ability to get all of these wonderful gadgets and medications has expanded, and as such, we found that a physician's ability to interact with the multitude of medical problems that a patient has can be absolutely overwhelming for one individual physician to the intricacies and the specialties of the disease process. So as a natural process, physicians have gone into little small specialties. But going back, a general surgeon was someone that basically took care of you from the top of your head to the bottom of your foot. And oh, by the way, if that meant that he or she needed to do an incision, a cutting, a removal of some type of body part, we did that too. Now, when you think of a general surgeon today, you probably just think of someone that, oh, maybe takes out an appendix or, oh, maybe fixes a hernia. Patients are oftentimes very surprised. Oh, you know something about the colon? Oh, you know something about the digestive tract? Yes, I do. And so to that point, the basis upon which I bring you information is based on, yes, my surgical training, but also on the larger platform of just understanding the body and the natural training that I've had. But I, as a general surgeon, am never the first doctor that encounters you in regards to whatever complaint you have. What that means is you've already gone to see a very knowledgeable physician that's been trained in our wonderful medical training education society here in America. We've got wonderfully trained physicians. That wonderful physician who you saw before me probably knows the PDR backwards and forwards and knows all 17 medications for this particular disease process. And that particular physician has probably already ordered at least one, if not more, medications to treat the specific complaints that you have before you ever come to see me. So raises a question. Why in the heck do you come see another doctor if you've already seen a doctor who's written the prescriptions for your medical problem? It's not working. It's not accomplishing the goal that either you and or your physician want to accomplish. So insert Dr. Walker, and here's the disclaimer. As you can tell, I tend to go a long time explaining things, but I think the explanation is important. When I first got out of medical school, I was just like every other physician that you'd ever want to encounter. I was rigidly adhered to, okay, a patient's coming to me for, and we're talking about colon health today, so let me pick one common colon complaint. Constipation. Can't have a bowel movement. Now remember, I'm not the first doctor that this patient has seen regarding this. Oh, by the way, I do have a particular expertise in regards to trying to figure out why is this colon not working, because one of the procedures that I do as a general surgeon is to ask you to get yourself all cleaned out and then meet me in our endoscopy suite where I have this wonderful technology that has a little light on the end of a long scope, and I can actually look inside your colon, survey it, and establish, is there any underlying pathology in the colon that is preventing the colon and you from achieving the goals that you and your physician want in regards to not having adequate bowel movements. So I do bring something extra to the table. I do have a technique that your physician doesn't have. But in the long and short of it, when we come to the point that the vast majority, what's the vast majority? Well, I'll throw out an arbitrary number. Let's just say 60%. That's more than 50. I'll even take you to 80%. 80% of the colonoscopies that I perform don't show any type of obstruction inside the colon causing the constipation. They don't even really show, in terms of the colonoscopy, any specific twist or turn that is obstructing it. And it's certainly from a standpoint of actually accomplishing the colonoscopy, which means going from point A, the anus, to point B, which in this case is the first part of the colon, the cecum. There's not even any adhesion, that horrible adhesions that's causing me not to have a good bowel movement, that prohibits me from going from the anus all the way across. So in the vast majority of the colonoscopies I do, we're very, very sad to say, I can't give you an explanation as to why you're not having good bowel movements based on the anatomy. Well, early on in my practice, after doing the colonoscopy, and I remember you came to me because of this particular colon problem, constipation, I can't just let you go home, because I used to try that when I was in residency. The unique thing about being a resident, you are actually a physician. I had a Texas license since 1986, even before I got out into private practice. So as part of still being in training for our specialty, to try to help us financially, we got to moonlight in little clinics. And I did my general surgery practice residency up in Grand Rapids, Michigan. Beautiful place. Absolutely. Had 2 daughters up there. Loved it. But the family was down here, so I had to come back home. But in Grand Rapids, Michigan, as a resident, I got to moonlight in some of the local clinics. And of course, before you get to moonlight, it's a job interview that you have to go on. And usually the interview comes from a result of your interacting and working with other physicians in the residency program. And in this particular case, the doctors who owned this clinic were the ER doctors who had interacted with me and had seen how I interacted with patients and had a fairly high opinion of me to ask me to come work in their clinics over the weekend. Well, after the first weekend of my going and working in the clinics there, and probably this time of the year, there were a lot of colds, a lot of sniffles that patients came to the clinic to see. And I don't know if you know too much about Grand Rapids, Michigan, but there's a strong Dutch heritage in Grand Rapids, Michigan. And the Dutch are very, I want to say this nicely because I don't want to insult anyone. Cheap? No. They hold on to a penny. And they, frugal, that's the word I'm looking for. New England. Well, after I worked in this minor emergency room over the weekend, I came back to the hospital where I'm on my residency rounds and I'm interacting with my fellow physicians. And I happened to come through the emergency room where the owner of the particular clinic that I just moonlighted in was there. And he pulled me off to the side and said, Frank, I just wanted to kind of give you some feedback. You know, overall, you did an excellent job at the clinic. I understand the staff really liked you. You're very talkative with the patients. They like that. I said, but it's just one little thing. When a patient comes to see you in the clinic or later on in your office, and they pay their hard-earned money, back then I think it was probably $15 or $20 to come see me, you can't send them home with just advice. And you can't tell them that colds are viruses. And remember, this is back in the 80s. Colds are viruses, and there's no cure for a cold, so go home and drink your chicken soup and Tylenol. You've got to write a prescription. Here my worlds are clashing. I've just gone through medical school at Southwestern in Dallas, where our instructor stood before us and said, viruses are not cured by antibiotics. They're temporary defects in the body you support. Don't write prescriptions for antibiotics because you're causing resistance. So here my medical school training was clashing with the reality. So they were saying that for the patient to value your information, you had to give them something that they didn't feel like they already had. And that was that prescription.
That's ridiculous. Yeah.
But it's the way of the world. And I forgot to say, I am here to give you a little understanding of what happens behind the cape here. Well, when I got out in my own private practice, and that meant I was running a business, and if you run a business or if you've ever run a business, who is right when you're running a business? The customer is always right. The customer is always right. And why is the customer always right? Because if you want the business to prosper, You want the customer to come back. And so the information is not right. It's the customer's perception of what they think they obtained from you or got from you. So when I started off in private practice down in Kingwood, 50 miles south of here, I was just like every other doctor you'd ever want to meet. You'd come to me, I'd do the colonoscopy, you came to me for constipation. I just have beautiful pictures that show your colon is absolutely clear. I'm a visual person in terms of how I learn. A picture really informs me and lets me know what's going on. So I've just shown you a picture and just described to you where you did an excellent clean out. I'm complimenting you. Look at the colon. It's wide open. There's no blockage here. Oh, by the way, here's some medicine for constipation because obviously you need it. They go home smiling. Did I mention I've been in practice for 20 years? You know, I don't know what it is about life, but as you go through life and you do the same thing over and over again, you tend to have these little epiphanies. I mean, for those of us who are of the Christian faith, I call it a Saul to Paul moment on the way to Damascus. And I don't know, maybe it was moving out of the city, Houston, Kingwood, because the year before I came up here, I actually was driving south from Kingwood down into the medical center, working at Herman Hospital in the trauma department, and but maybe it's something about heading my car north, driving up Highway 59. I get to see the sunrise every morning. Sometimes there's a little low clouds and mist. It's just a beautiful place. Something about coming up here, I said, there's a television or movie show where I think it's called Network or something, and excuse my profanity, but the message says, I'm mad as hell and I'm not going to take it anymore. Well, as I drove up here, I said, what am I doing? I have knowledge to give patients that may be of benefit to them. Why? Because it's not the same message they get over and over and over again. And after all, from my own personal perspective, if I'm dealing with something, a problem, or something that I'm trying to figure out, usually it's not the same concept that makes the difference. It's bringing in something new to the mix. So I said, let me just step back and reanalyze what I'm doing and how I'm doing it. And yes, we're talking about colon health, but believe me, this epiphany was about everything I do in practice. I mean, just as an example, when I came up here also, there's a lot of cellulitis and methicillin-resistant bacteria up here, a lot of infections that are up here. And of course, you know, whenever you get an infection, how do you treat an infection? Antibiotics. Antibiotics. But again, being the doctor that is the second doctor to be seen, who do I see? I don't see the patient who just got that infection. I see the patient who's already been treated by a doctor, who's already received antibiotics, and the antibiotics didn't work. And now they come to me. Well, why are they coming to me? Well, after all, I'm certain I have to go in there and cut, because obviously the antibiotics didn't work. I got to cut out the body. That's the answer, right? Well, for another lecture, the answer is no. So let me get back on topic. So here we go. The message today is about colon health. This long disclaimer is simply to say the vast majority of you who are sitting in this room probably won't benefit a lot from what I say because you're already doing it. But there will be a small percentage of ladies here that what I'm asking you to do, because what I am asking you to do is radical. What do I mean by radical?
Maybe change.
Change! Yes! The young lady stole my thunder. I'm going to ask you to make a lifestyle my father dearly. He's 90. He will be 94 this Saturday. He goes to the hospital on a more than frequent basis for problems that 9 times out of 10, and they are serious, because he's 94, so they impact him. But I'm always amazed that at the end of the visit, and I get the phone call from my sister, who they're in Austin. She lives with him and his son, and God bless her, because otherwise I don't know what I do. But I'm just so amazed that at the end of the conversation, oftentimes one of the contributing problems is, and oh, by the way, Dad is constipated. His bowels are all blocked up. Now, this is the man who raised me, and I can, well, when I say the man who raised me, my father, I guess I have to give credit to my mother also, but he was at the same breakfast table that I was when I was growing up every morning. I remember that little bowl of warm prunes that I had to eat every morning with oatmeal when I was growing up. I remember that. Now, I'm not sure why he doesn't remember that. Because at 93, 94 years old, when I try to have a conversation with him, and it's a delicate conversation. My father is, well, he's 94 years old, so you can understand what background he comes from. I mean, the tradition. Grew up down south here in a place called Gonzales, Texas. So he grew up on the farm. Went from that, and he was in World War II in New Guinea. So, you know, military person. He had his Saul to Paul moment over in New Guinea when he thought he was going to die and said, if you get me through this, I'll give myself to you. So when he came back to the States, he went to theology school, and he's a United Methodist minister, his master's degree. This is all going to say that, you know, when you make this transition, it's all good and well, but the men of yesteryear were real men. They controlled everything. And in my father's case, the control comes straight from God. And I don't mean this in a negative way, but I'm just saying, everything comes through him. So when I try to have these conversations about lifestyle changes,
You're just the kid.
I'm just a kid. But you know, there's a glimmer of hope. And my father's always instructive in my life, because I truly believe if I can figure out how to make a difference in his life, any patient that comes to me is easy. And I think I might be cracking the veil there just a little bit, because my sister, I was having a conversation with her the other day, and she didn't realize what she was saying to me, but she said, you know, I was just saying, well, how's Daddy coming along with, you know, he's home from the hospital. She says, yeah, he's doing okay, but, you know, he said to me the other day, well, I guess I just can't eat like normal people. And I said, hooray! I'm getting to him. He understands. Colon health. Colon health. What can you think of in your life that you want to maintain outside of yourself? I'm always amazed that when you ask a patient to look at some process or some individual outside of themselves, they can see it very clearly. Ask them to look inward and they get confused and don't have a clue. So my question to you is, what can you think of in your life that you'd like to maintain? Do we have cars? Some of us. Would you like to maintain that car? Well, if you have any interest in maintaining that car, is there a schedule of maintenance for that car?
Yes.
Should be. But we've already established that this is something that we have a vested interest in maintaining. That's important. So yes, there's a regular schedule of maintenance. Now I have to confess, now, you know, whenever someone tries to give information, I always try to separate myself personally from the information that I'm disseminating. Because the last thing I would want to do is to make you feel as though I'm judging you, or make you feel as though I'm trying to make some comment on where you have been before. So this is, again, my little disclaimer. As far as maintaining, I've got a 2004 Ford Expedition out in the driveway that I don't get regular checks on. It's got 385,000 miles on it.
Wow.
So how it runs, I don't know. Through the grace of the good Lord, He needs it. You know. So no, I don't do regular maintenance, but I'm trying to do better. I'm trying to, and that's the key. So, health requires what?
Maintenance.
Maintenance. Wait. Did I get everyone on board there? Health requires what?
Maintenance.
Maintenance. Now, here's just a question. And it's just a question. You don't have to participate if you don't want to. But I'm just curious. I can tell you what my maintenance routine for that car is supposed to be. You know, every 6,000 miles or every 3 months, I'm supposed to take it into Ford and let them do an oil change. I know that. Now, if I'm a little tardy, it's okay, because when I think about it, or when it comes to me, I know how to get back on track. So here's a question. How many of you have a regular maintenance schedule for your colon? And you see the hands that are raised. I told you this message isn't for everyone here. So for those that raise the hand, whether you're on that maintenance program or not, you've got a plan. Now, for the rest of you ladies, let me introduce a plan to you. Now, I'm just full of disclaimers here, but I feel they are important, because at every step of the way as we make these transitions, I need to make sure you understand I am the product of my practice, of my life. I come to you today with a message that I would not have dared discuss with you 10 or 15 years ago. But the message is the result of the practice of medicine, which is based on the scientific theories, the scientific information that I learned years and years ago, and then putting it out there and seeing how it works in this laboratory we call the real world. So it is the result, not just of an arbitrary thought, but of true and tried recommendations. Now, something else about me, which is a double-edged sword. When I think about it, I would think that if you think about some characteristics about a surgeon that you would want to go to, I think it's a good thing to say that they're probably very fanatical about detail. I think that that would be fair. But here comes the rub. I am fanatical about detail. My wife gets on me all the time because she says, "You just overdo. You just overdo. You take things to an extreme." Yes, I do. I take things and I make recommendations to an extreme because I look upon myself as that Olympic coach. Not the Olympian, but the Olympic coach. I see myself as the drill sergeant of the Marines, not the Marine. And in both cases, that Olympic coach, that drill sergeant for the Marine, these individuals, these coaches, this drill sergeant, has the unique responsibility of getting the most they can out of found these individuals that have great potential. In the case of the Olympian, they've proven they have great skills, and we're trying to push them even harder than they've ever been pushed before. In the case of that Marine is going to go out and serve and put his life or her life on the line, and I need to prepare them and push them harder now so that when they get out there on their own, they can rise to the occasion. So, this is the way I practice medicine. It's the way I approach things in the operating room. And as I share with you my recommendations for colon health maintenance, what I say to you is going to sound extreme. As is the case in all things in life, as I set the bar high, it's a high bar for you to strive to. But remember, ultimately, the whole reason we're doing this is because the proof is in the pudding. It's to gain results. So we go back to that original query or that original complaint. We want to have optimal colon maintenance and health. How do we know we have ultimate maintenance colon and health? The colon's functioning properly. And the colon, in case we didn't know it, is the body's garbage can. And things are working properly for us at home in our garbage can when the folks come by, the garbage folk come by on a regular schedule and empty the garbage can. And it really would be a nice thing if, I know the garbage men come on Monday and Friday, but you know, if we happen to have a party one day and had a whole bunch of trash built up on Tuesday and they're not supposed to get there till Friday and it starts stinking and it's smelly, you know, it would really be nice if the garbage men knew that we had a lot of trash and they'd come and empty it. And keep that garbage pail empty because we don't like stinky trash. Well, by the time your contents of your digestive tract get to your colon, guess where those contents should be? Should they be in or should they be out? Out. So for those individuals that tell me, oh yeah, my garbage can empties every 2 to 3 days, I say, oh really? I do it metaphorically. But the point is, it's toxic waste. Your body doesn't benefit from holding that in. Your body gains no benefit. It needs to be emptied out. Now, remember again, I keep saying, science and the real world clash. When our wonderful, beautiful baby boys and baby girls are first born and we bring them home and we're loving them, kissing them, and just so proud of them. And as they begin to develop and begin to start walking around a little bit, what's one of the first things we start training them to do? Potty training. Now I'm curious, does that usually mean that we're training them to evacuate on a frequent basis? Or does it usually mean you're going to school, don't have a bowel movement, or we're going here? It means we're usually training our young children to hold their bowel movements in, not evacuate. So for years and years and years and years of training, there's no reality with what the body needs and wants in terms of trying to be efficient at removing the waste from our body. Au contraire, it's just the difference. We're taught to hold our bowel movement. So when I'm talking to a patient in the office and I begin to talk about colon health, and I mention, oh yes, do you have a bowel movement 2 or 3 times a day? Diarrhea? Diarrhea. I love that word. I mean, I really do, but you understand, I'm kind of weird. Diarrhea. It means so many different things to different people. Eliminating the waste from your colon is a good thing. Can it be inconvenient? Yes. Can it be sometimes embarrassing? Yes. But remember, eliminating the waste from the colon is a good thing. It also is something that is directly impacted by, remember I told you that trash can that I had? Sometimes it doesn't have a lot of trash in it because it's only me and my wife. But sometimes it's got a lot of trash in it because we just threw a party. So the elimination of waste will definitely be directly impacted on what you put in your mouth. Imagine that. You have control over what comes out to a degree because it's real world. Nothing's perfect. No one has total control. But to understand that for good colon health, we need to begin a lifestyle modification that is going back to what is the function of the colon. I learned this in medical school. There's an authority there. It's supposed to empty the waste from the body, not hold the waste in the body. So, to that point, what promotes the stool evacuating out the colon? Does anybody know?
Fiber. Water.
Fiber. Water. So if we want to promote good colon health, we want to promote the movements through the body, all we need is fiber and some fluid. Now I'm just curious. Raise your hand if that's the first time you've ever heard that. I mean, I know there's somebody here. I'll repeat it. To allow the colon to work properly, to function optimally, we just need to make sure the colon has adequate quantity of fiber and fluid in the colon. Is this breaking news to anybody? But wait a minute. Some of us have problem having a bowel movement. And for all seriousness now, I'm very, very serious now. If we know that, let me backtrack. What's a source of fiber?
Fruits and vegetables.
Fruits and vegetables. Oh, wait a minute. You're stealing my thunder. Check my notes. Is somebody?
I heard it from you before.
You've heard it? Oh, okay. I said the disclaimer that I couldn't get away with saying this the first time. Fruits and vegetables. So fruits and vegetables, excellent source of fiber. Fiber helps the colon to function properly. So why do the vast majority of patients that have problems having bowel movements, why do they have problems having bowel movements? That's okay, I like it. But I'm asking you to feel and talk and think with me a little bit. Well, why? I don't know. That's. I guess I'll go to my way of thinking. It's not cool. It's not cool. Now, remember what I said before. I'm asking you to make a lifestyle change. You guys already know the information, so I guess I'm not going to get repeat customers, but yes, I will. Because I'm not writing a prescription for you today. Before I came over here, I looked at the PDR. There's about 17 different prescription preparations, enemas, that are labeled laxatives within the PDR. I'm not writing any of those prescriptions for you today. Why? Because you all have primary care doctors. You go to see them more frequently than I. They'll write all the prescriptions you want. So I don't need to reinvent the wheel, because if that works for you and it fits your lifestyle, God bless you, because we're just here to help you with your medical health. But for those of you who that prescription doesn't work, after sitting down and having my Saul to Paul moment, I'm here to get back to basics for you and let you know the anatomy and physiology of the colon and how it works. And by informing you, hopefully you will be able to take this information, establish a new lifestyle modification, and get on the road to better colon health. Fruits and vegetables are the key. Raise a hand, but I'm a diabetic. Then modify. Instead of fruits and vegetables, it's vegetables and vegetables. But wait a minute, I can't eat raw vegetables. Well, cook them. But wait a minute, seriously, I'm on a medication and they've told me I can't eat leafy green vegetables. Well, wait a minute, I think there's some orange ones. I think there's some purple ones. I think there's some red ones. Make the modification. So although I did tell you I'm giving you new information about a lifestyle modification, I'm asking you also to take some responsibility of putting the recommendations into practice. As the Olympic coach, I'm going to coach that Olympian as much as I can, but when it comes to running the race, when it comes to being out on the field, it's the athlete that has to do the work. My recommendation should hopefully make sense to you. I am not a rocket scientist, never could be, so I always give the disclaimer, I'm just a man, and I'll accept I like things simple. So it's not entwined in any kind of mystery. Fruits and vegetables, I tell patients, not that I have any stock in them, but drive right up the road. It's called Walmart. Go in the front door, make a right, close your eyes, because the bakery's right there. Right past there. Oh, fruits and vegetable land. And you can begin to pick and choose. Question, what about frozen fruits and vegetables? What about fruits and vegetables in a can? It's okay. The freezing in the can didn't change the fiber content. It's okay. So any fruit and vegetable is fine. You've got the world at your feet to make the choices. Not the ones Dr. Walker recommends, because some patients will turn around to me and say, well, which fruit or vegetable do you recommend? The answer, the one you will eat. Because George Bush won't eat broccoli. That's okay. Maybe he'll eat asparagus. The one that you can tolerate. And here's the other defining part of my recommendation. We've got the understanding that to optimize your colon health, leaving this room today, you're going to make a commitment to have a regular schedule maintenance of ingesting fruits and vegetables into your mouth to get to your colon. Didn't say you're going to go on a new eating binge. I didn't say that. But to get the medicine, fruits and vegetables, to the part of the body that needs it, the colon, it has to go through your mouth today. Maybe in the years forward we'll find some injection or something, but right now it's got to go through the mouth to be processed to get to the colon. So I'm not asking you to get on a new diet per se. I'm asking you to begin to ingest a new medicine that will help your colon to thrive. And here's the other part of the prescription, because you know whenever they tell you to take a medicine, they always tell you how frequently to take that medicine. And remember, I've already given the disclaimer that what I say seems unrealistic, so here it is. Every 2 hours that you're awake, get into the habit of snacking on one handful of your choice of a fruit or vegetable. I mentioned my father's United Methodist minister. My mother and father were both teachers, and they always said, if you want someone to understand something, say it 3 times. The regimen I ask you to get on is every 2 hours of the day. Get into the habit. Right now, you're at a meeting. Of course, it was a little lunch meeting, but let's say it wasn't. I want you to reach down in your purse, open your purse, pull out your little sandwich bag of celery, carrots, grapes, apples, prunes, and just discreetly place it in your mouth, and oh, she must have some wonderful chewing gum that she's chewing and swallowing. Every 2 hours of the day.
No, just during the day.
Every 2 hours of the day. Now when I say the day, those are the waking hours. So yes, it goes into 9 and 10 and 12 o'clock if you're awake. Here's another concept. When you go outside and turn on your engine, when you go outside, crank the car, turn on your engine. Of course, you've got gas in the tank so it can run, but to keep that engine running, what does that engine need? Oil. Oil to lubricate. When does that engine not need that oil? When it's turned off. When is the colon turned off?
When you sleep.
Never. Okay. When is the colon turned off?